Welcome to this week's edition of Health Corner. Today we're going to talk about postpartum psychiatric disorders. I know the name sounds complex, but what that simply means is some women who have children end up with mental health problems, and not all cultures or people understand this problem. It is a problem, and today we have a consultant in mental health. It's a consultant psychiatrist and specialist in public health, Dr. Chinedu Madi, who will explain this condition in detail. So, Dr. Madi, you're welcome to Health Corner.
Thank you for having me.
Yeah. So, postpartum psychiatric disorders. What is post? Well, I know obviously it's a big name.
Yeah.
What is it all about?
It's mental health problems that happen after childbirth. So when a woman has had a child,
Yes.
some mental health difficulties that arise when they've had the child. That's what it is.
Right.
So, women undergo several emotional changes during pregnancy. You find out that they have emotional lability, which is the emotions are up and down in the first trimester when they're having early morning sickness, all the difficulties adjusting to the health problems they face initially. Then bodily changes, the tummy begins to grow, they put on some weight. This causes a lot of emotional problems for women. Then in the last trimester, you have there's this preoccupation about the child arriving, labor, so on. So these are
But
different
there's
periods.
so much going on
through pregnancy.
Right.
So different women have different threshold for coping with all the adjustments.
Right.
Some people can cope well, some people struggle. And then different factors contribute to how you can cope during pregnancy. So, with your cultural background as well, you have some cultures that are very supportive.
Yes.
You have some cultures that when women start complaining, they say get on with this part of life, which is not very helpful. Some people are just naturally more resilient than others.
Right.
But most women cope well, get back to their routine after childbirth without any problems. Then you have the difficulties, some of the difficulties encountered during pregnancy and the changes that occur that result in some psychiatric manifestations. So even though some people cope well, some people will not. So then you begin to have some psychiatric manifestations, and that's what we call postpartum psychiatric disorder.
Oh, that's very good.
So if you look at them, you have different ones. But let me just start with what we call postpartum blues, which is not a mental disorder on its own. It's something that happens in most women after childbirth. It's mild and it stops on its own treatment really, and it affects about 50 to 80% of women. So it starts in the first week, usually after birth, and resolves within a week or two as well. So we find out that people with increased anxiety and depression in the last trimester are more likely to develop postpartum blues. So it's a period of increased emotional reactivity in women. So some of the symptoms will be labor mood. So your mood is up and down.
Yes.
Just tearfulness. They can't sleep. They're tired all the time. They're very irritable. And management is just that's where the classes women go before they have children, especially first pregnancy is very important.
I know they do offer parental classes.
Classes. Explain what you expect. It's very helpful. It does help with postnatal blues. Then just reassurance. Just tender loving care by family, friends, partner is very important.
Right.
It's not asking them to get on with it. It's life. No, it's a time to look after them, support them. That's what they need.
During pregnancy or after they've had the baby?
This is after all through pregnancy anyway. But I'm talking about postnatal blues now.
Yes.
What they need is support, reassurance. Then increase support from professionals, friends, family.
Right.
Some people have severe postpartum blues, which will develop into depression.
Yeah, okay. For the interest of the viewers, the good thing about Health Corner is that we try to speak in common language, so that viewers will understand. So postpartum means after birth.
After birth.
Okay.
So post is after
birth.
Birth is child. So postpartum is after birth.
Right. Okay.
So now when we talk about postpartum depression, we mean depression after childbirth.
Yes.
Yeah. So this is depression that occurs. It usually occurs within the first 4 weeks of childbirth, and it peaks within the first 4 months, and it affects about 10 to 20% of women. So if untreated, it can run for up to 6 months.
Really?
So if untreated. So women with postpartum depression, they report the following, and this is from research that was done, and it's very important so that you have an idea of what they're thinking. They say difference between expectations and reality of motherhood. So there's this expectation, especially first pregnancy, is all going to be this beautiful child, son or daughter will become, and everyone around is going to be great. They did not have the child. What happens? Your mom will be there, family, they support you. At night, everybody will go home. See you tomorrow. Kiss, kiss, see you tomorrow. Partner will do his best, then he goes to sleep.
Yes.
You're there with the child. You're waiting for the child to sleep. Sleeping 2 minutes, up for 1 hour. Keeping you awake, you're irritable, you're stressful, you're stressed, you're suffering.
Stressful, yes.
So and that's not what they bargain for. They hear it, but they don't realize how difficult it is.
Until they've gone through.
So there's worsening of negative emotions. That's what they've said. Then there's this pervasive sense of loss of control. You can't have no control over anything. You don't even have control over when you eat, when you take your bath, the child takes over. Yeah. There's a sense of loss of control of sense of self, and relationships as well. So most of them admit that that's actually when they need help.
Right.
So it's important to know this. And what are the symptoms of depression, so that people will know?
Yes.
Low mood, you're tired all the time. You don't get enjoyment in maternal role, so you don't even enjoy being a mother. You're irritable all the time. Difficult sleeping. Even when the baby finally manages to sleep, you're struggling with sleep yourself, and you feel guilty in relation to parenting ability. You feel I'm useless, I'm hopeless, I can't even look after my baby, I'm such a worthless woman. Anxiety feelings, you're panicking. There's this obsessional fear, and when I say obsession, I mean repeated. It's coming all the time. You try to stop yourself from thinking, but you keep thinking. So there's this obsessional fear or image of harm coming to the baby. Thoughts of wanting to harm the child sometimes, that's not common. The good news is that it's not common in postnatal depression. Then thoughts of self-harm, poor concentration, poor motivation. So what are the risk factors?
Yeah, so I was about to say, risk factors, because viewers are very keen. Okay. What are the risk factors?
Risk factors. Having had postpartum depression in the past. So depression, if you had depression before you became pregnant, that's a risk factor. If you have family history of postpartum depression or just depression.
So it runs in families?
It runs in families as
really?
well. Yeah, it does run in families. Or if you've had severe postpartum blues, then you have psychological problems during pregnancy, poor social support and marital relationship. And this is where family comes into it. And the good news, if you're looking at kind of different groups depending on your cultural background, some people are more supportive. People of black origin, ethnic minority. Most times they come together. There's a big family unit. There's church, religion as well involved. So that's time to rally around such people and support them. Partners in particular, they can play a key role in this. So then recent adverse life events will cause that as well. Young maternal age, predisposes to that. Then infants with health and problems, obviously difficulties, difficult temperament. These are things. There are some studies which have said that having difficult childbirth, obstetric complications can lead to this, but the associate these were weak studies, so that's why I haven't specified them.
So having a child at a young age is a risk factor. Okay. And then obviously there are consequences for the child as well.
And we know that disturbed mother-infant interaction, which could impact on child development negatively. So that depression, the mother doesn't bond very well with the child, and negative mothers with depression who have negative response in the way they interact with the children, and this can lead to poor language skills. Their social and emotional development in the first year will not be as good as it would have been. Then there's insecure attachment in a 18 months.
Yes.
Because usually a child, when the mother turns up, should smile, be happy to see the mother. But you find out that with depression can lead to what we call insecure attachment, where the mother comes in, the child looks confused.
Really?
No smiling.
So the child probably picks up that the cues.
Yeah.
Really.
So it's not good at all. Then also associated negative effects on other family members. Because with mother being people available to actually support it. Exactly.
Right.
Yeah.
Okay. Right, okay. So, yes, viewers, this is Health Corner, postpartum depression. That is depression occurring in mothers, new mothers. This is what the topic of today is all about. And you can see that there are risk factors, there are things that make people get this. It runs in families, young age, Dr. Madi has said, and if someone has history of depression means that if you've had depression in the past. Now, pregnancy is a stressful event. We're going to summarize later in the program. We'll take a short break, and when we come back, I'm sure there are things we can do to help mothers who are predisposed or who are at the risk of having postpartum depression. So stay tuned, don't go away, we'll be right back after a short break.
Health Corner on Ben TV by Crystalife is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries. For the educative and innovative medical show by Crystalife.
Meet Anne. Anne is thinking about sending goods to Africa. Her first thought came to MDS Cargo. Send goods to Nigeria, Ghana, and many more countries in Africa. Excellent customer service and after-sales support. Free London and Essex collection. Online tracking.
Fast Cargo caters for all your door-to-door sea and air cargo services from Nigeria to the UK and UK to Nigeria. With prices from 99p per kilo, you can't go wrong. For prompt, efficient and dependable service, call Fast Tracks Cargo today.
Health Corner on Ben TV by Crystalife is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries. For the educative and innovative medical show by Crystalife.
Welcome to the second segment of postpartum depression. Today we have a consultant in psychiatry and a specialist in public health, Dr. Madi, taking us through what postpartum depression is all about. So, Dr. Madi, I know you've given a very good background in the first segment. So this time, what are the things to do? Because I know there are different severities. Are there things one can do to help with this disorder?
Sure. Just like you said, you have mild and more severe ones. So for the mild ones, what you need is extra support and non-directive counseling, where you just can give them general advice from trained primary care professionals, like health visitors, people who come to the house. Then you have psychological therapies like CBT, cognitive behavioral therapy, dynamic psychotherapy, and that's trying to understand what's happening with this person, their thoughts and feelings, and trying to support them, talk through things with them. Then you have interpersonal therapy, and that's looking at relationships as well. The person's behavior, how you could be contributing people around them. Then providing help to patient and family, support groups involving patient and family. It's always good to talk about partner, it's not just the patient, because the partner plays a key role at that time. Then training patients in infant massage, which is actually a way of bringing them to be close to the infant and touching the infant. It does help.
So that contact,
that contact is there. Then the moderate to severe cases we treat with antidepressants. Of course, you have to consider whether the mother is breastfeeding in doing this. So there are some medication like paroxetine, etc. These are antidepressants that can be used. Yeah. Then psychological therapies as well. Or you can combine antidepressants with psychological therapy.
Right.
So these are some of the treatments.
Yes.
Yeah.
So
that's about depression.
Yes. And then there's the other
The big
ones, the psychosis. Yes.
The big one called postpartum psychosis, and that's psychosis after childbirth. It's the most severe postpartum psychiatric disorder, and it occurs in approximately 1 to 2 per 1,000 people. So it's not very common, which is good news. So presentation can be dramatic. Can just start happening within 2 to 3 years after childbirth. Most people will develop the illness within the first 2 weeks.
Really?
Yeah, to the so anytime within the first year. Really. Yeah.
Within 2 weeks, is it? Of delivery, okay.
Yeah, some people within days. Yeah. So it occurs mostly as an affective illness. When we say affective, we're talking about mood problem. When mood is all over the place. Then you have, some of them will have atypical presentations where you're not sure of what's going on. There's anxiety, there's mood problem. 1 minute they're happy, 1 minute they're down, they're crying, they're laughing, they're seeing things. Then you have some that will present mainly with non-affective or what we call schizophrenia-like symptoms, where it's mainly unusual experiences, thinking that.
So they'll be seeing things, then people are hearing voices. And Right.
So if you look at the different symptoms, you have the manic type, where they are elated over the happy, doing things that they wouldn't do usually, talking too much, being over familiar. Then you have depression, where they are down, just like we described depression. Then the mixed type, where up and down, thoughts are all over the place. You can't really make out what's going on. Then the schizophrenia-like type, which is mainly unusual experiences. Could be hearing voices telling them they're useless, they're hopeless, you can't look after their child. Some of them will even think their child, their children are evil. Evil, that is evil, is the devil. The child has come here to kill us. Or some will be thinking of killing the child as well. That it can be very serious. Then there's the thoughts are generally disorganized, easy to follow their line, difficult to follow their line of thoughts. So these are some of the symptoms you see with them. So I think that takes us to risk factors. And how to treat. So the main risk factors there will be past history of postpartum psychosis. If you have had this in the past, that's a risk factor.
Happen again.
Past history of bipolar affective disorder. If you have mental health, that's called bipolar.
Bipolar is the one that mania and depression.
I'm sure we'll be talking about that
at some point
in the future. Then family history of if it runs in families. Then in terms of management, most patients will require hospital admission. Most patients. But if you live in an area where you have very good where you have very good community service available, where you have them, then and they're not very severe, they can be managed at home with intensive support. So if you're talking about admission, you're looking for what we call modern baby units, where the baby will be there as well.
So the mom, it's not just the mother,
but the baby as well, to support them and to ensure to continue not to break up the bond. And then of course, when they're in hospital, you have to treat them with medication.
So and then there's something electroconvulsive therapy, ECT.
ECT, electroconvulsive therapy, which is we give people electric shocks, to help.
So you can.
It's not commonly used these days, but it can be used under controlled environment with anesthesia.
It has to be done by specialized centers.
It can be done. So these are the treatments.
Okay. And in the book here, this is very important in the black community.
If you look at there's lack of knowledge about maternal mental health problems. You have cultural differences in the way people perceive mental health. There's huge stigma attached to mental health.
It's the spirit.
They make different interpretations. You see a woman who is suffering, and is either they're saying get over it, you need to be strong, or you're putting the family to shame, or this is a spiritual attack, you need to go to church, they're praying. The poor woman is suffering.
And that doesn't really help.
And there's treatment available. So we need to be aware of this.
This is important.
And some of these women are seen as failures when they develop mental health illness. They're not strong enough women. So we have to look at the effects of religious beliefs, right? Belief as well on diagnosis, where people just believe we have to pray instead of taking to a psychiatrist to make a diagnosis and treat.
Yes.
So these are things people need to be aware of. That it's a mental health, it's an illness. There doesn't need to be any stigma. Just like diabetes, hypertension.
We should be treated just like any other illness.
Like
it's not really
okay. And believe that family support is enough without seeking professional help. That's what some of them think. That's not correct.
Yes, that's not correct.
We need family support, but we need professional help as well.
Right.
And patients themselves, even if they want to get professional help,
Yes.
most times they don't, because in the black community we usually have big family ties. They don't want to go against the family.
Right.
And all these, the close family units, it can be turned to good effect.
Right.
Instead of it being a barrier to receiving treatment, you need to use it, support the person, help them get help.
And this is one of the things we'll address in this show. Explaining things to the public so that they know where to seek help. And having knowledge is very important.
Information is power.
Yes. Having knowledge. Okay. Yeah. So right.
So in summary, there's clear evidence to show that women can develop mental health problems following child health. There's evidence to show that. There's no doubt about that. And the problems they range from mild to severe. So there's help out there for new mothers that develop mental health illnesses, and there's need for people to be more aware of mental health disorders following childbirth.
Yes.
And recognize that professional help is needed for treatment. So poor mental health affects babies.
Yes.
Adversely and affects family as well.
The mother's health, yes.
So
the mother is on the center of the family.
Exactly.
Right. Can I ask you, viewers might be asking, postpartum depression or postpartum psychosis, which one is more common?
Postpartum depression is more common, much more common.
And that is the one that people might even overlook.
That's the one people might overlook, and just say, get over it, it's nothing. Some people just don't believe in depression.
Right.
They just think it's part of childbirth, you get over it. And the woman suffers, the baby suffers.
Yeah, because, okay. And your experience among the black and ethnic minorities, is it just the blacks, or what about the other ethnic minorities? Is there the awareness that's good?
I think my experience from my work as a psychiatrist is that the white population generally will accept their scenarios and seek help. But people of my ethnic minority group, blacks, Asians, and some religions will try to keep it away.
Right.
They just want to be left alone and manage it. They don't tell you that they've dealt with this for years. They don't even believe in it. There's nothing like I can't tell you the number of times I've had discussions that people have told me, forget, it's nothing like mental health, you will same time.
Really?
And people actually suffering.
Right.
So it's important for them to know that it's a mental health problem that can be treated easily.
Yes.
Because we're talking about chemical imbalance in the body.
Yes.
Prayer will not take it away.
No
chance. Family support and talking will just take it away.
This is very
We're talking about chemical imbalance that needs medication to resolve.
And the good thing is, this mental health problem among new mothers can just be treated like any other disease.
Most definitely.
Yes,
sure.
and they should not be kept at home and being dismissive that these things do not occur. And it's the woman that suffers.
It's the woman that suffers, the child.
It's the child, and even the partner.
The partner as well.
Right.
Even the family that are trying to stop them from getting help, they suffer as well.
Right, exactly, because they will always have
be
stress. Right, okay. This is Health Corner. We've talked about postpartum depression and postpartum psychosis. These are mental health problems that occur in new mothers. Right, you can see the consultant has actually describe this condition in detail, and the take-home messages today are: seek help if you feel or if you suspect a mom is having any of this. It is treatable just like any other problem. And don't believe that you can pray or dismiss that there are mental health problems in such patients, because it is not just the patient and the child that suffers, the partner and the whole community and the whole family suffers as well. So, today in Health Corner, I'm sure we've learned a lot from you, Dr. Umadi, and it's been very, very informative. And I'm sure that viewers might have questions around what you've just spoken about today. And viewers, you are welcome to send us text, email, or check our website for more information. But Dr. Umadi, I'm sure if anyone contacts you, we're happy to.
Oh, most definitely. Most definitely. I'm always happy to do that.
Exactly. So, yes, it's a pleasure having you
Thanks
on Health Corner today. And yes, if anyone wants to support Health Corner, you are always welcome. And Dr. Umadi, it is a pleasure again, and I thank you so much for giving us a clear insight, into this mental health problem among new mothers. Thank you very much for today.